Hi there. I'm here today to talk about a subject that I have recently had enter into my life, and that is a diagnosis of macular degeneration, age-related macular degeneration. It's called AMD, is the acronym, and it runs in my family. I have a genetic predisposition for it, but I was still very surprised when I received this diagnosis. And the reason that I'm making this video is because I wish I had known a handful of things that I want to share with you today. I think it would have made me a lot less afraid, and it would have given me a greater perspective early on. If you have just recently been diagnosed with AMD, or if somebody that you love or in your family member, dear friend, has been diagnosed, it's really important, I think, first of all, to stop a minute and take a deep breath. It's not a diagnosis that will make you go completely blind. It doesn't make everything go into darkness, even if you get the very worst case scenario of it. Macular degeneration impacts you in your central vision, the front part, the fine motor part, or for tuning in, for reading and sewing, even facial recognition. And so, if it worst case scenario, it is not a good thing to have. If you reach the worst stage of it, but that's the worst, right? You still would have peripheral vision, and it's highly unlikely that even if you are diagnosed with AMD, that you will reach the point where you can't see. So that's what I would like to start with, because I was under the impression that I was gonna be blind. There are two kinds of AMD, of the age-related, two kinds. There's the dry form, and then there is what's called the wet form. They call it neovascular. And so these two particular forms of AMD, is confusing because you have to have the dry form before you get the wet form, but not everybody that gets the dry form gets the wet form. And I ended up winning the prize, and I had both. I had no idea that I even had the dry. And I get regular exams with my ophthalmologist, but apparently the dry form that I had was very, very early stages and very mild, and somehow I just sort of skipped the tracks and ended up with a wet form. I'm going to explain a little bit about which kind each is. And this is layman's terms. I am not any kind of a medical professional or provider, so that's my disclaimer there. The dry form is caused from little tiny drusen that form in the macula of the eye, and many folks get these over a period of years. They're super common. And you can have these little drusen, which are like these little yellow flecks that show up on a scan, and they're made of sometimes like little fatty deposits, a little bit of waste material that forms in some people's eyes, and mean basically nothing. You can have these drusen and them never progress to AMD. All it is it's just like a little flag that if a person's going to get AMD, it starts that way, right? It doesn't mean it's going to progress. It's like seeing clouds in the sky. It's not going to rain without the clouds, but just having clouds doesn't mean it's going to rain. So that's the way I equate that. Anyway, these little drusen, if they develop and there gets to be enough of them to where they start to kind of cluster up, they can impact your central vision. They block the ability of the retina to be able to function and create an image in that area. Sometimes these little drusen can cause what's called a wet bleed, and that is where the waste products behind the retina, this is, I think, the most logical theory, because I've read And they're sort of, this is the area that they lean toward this being the bigger part of the problem, that some people's systems just cannot rid themselves of waste buildups in the back of the retina. And it starts to create these fragile little tiny blood vessels that's like the retina's trying to heal itself from this waste buildup. And they kind of creep their way through the back part of the retina. And the retina is comprised of 10 very thin little layers. But these little buggers make their way through, and they bleed through the back of that retina like little weeds. And it causes distortion in the vision. And so that is what the wet form is. Now, dry AMD, you can have drusen and it never progress into being an advanced enough form of the dry AMD over time, over years. People can have it and it never impact their vision. So having dry AMD, for starters, doesn't mean you're going to go blind. In fact, I think the stats show something like 10 to 15% of people with a diagnosis of early dry AMD ever develop a form of dry AMD that impacts their central vision. When it gets to that, it's usually called advanced or geographic atrophy, the dry AMD form. And again, the dry kind is typically a pretty slowly moving form. Now, of the dry AMD, only 10 to 15% of that subset go on to develop what's called wet AMD, neovascular. And that is the one that a person really has to pay attention to, because that is a quicker progression. And if you have that, you have only a certain amount of time to get in and get treated for that, because that can deteriorate your vision permanently in a really rapid way. So they're two different things, but they come from the same start. They always come from the dry form. And here's another strange thing that is kind of hard to wrap a person's head around, and that is that you can have the advanced form of AMD, meaning the wet form, show up, but the dry form not being advanced. And that is what happened to me. I had very early dry AMD, wasn't even diagnosed with it because it was just so minimal. It was just kind of like your typical aging macula drusen. But the reason that I found out that I had AMD is I had a little bleed behind my retina and one of my eyes. And that's what got me started on this journey is that I learned that I had this bleed. And for me, what it looked like was a little black or gray circle dot. And it was not like a floater, in that a floater will drift with your vision. You can kind of squirt it around. This was fixed in my vision wherever I would look, and it wasn't right in my central vision. It was kind of off, but it kind of moved with my with the sight. It kind of moved with it. And so it felt different. And I went in and was diagnosed with wet AMD, and that was a long, hard day. Didn't see it coming. So what I'd like to talk about, I guess, a little bit here is that if I had known what I know today, I would have been a lot less afraid. And so if you, like I said, have been newly diagnosed, there's a lot of reasons to feel encouraged. The wet AMD is treated with injections, and you have to have them. Some people have to have them really regularly, like 4 to 8 weeks, and some people just have one bleed. And are treated and then monitored. There isn't really a one-size-fits-all for this particular disorder. So in my case, I was treated, and I've gone, I think, 5 months since my first and only injection so far. I anticipate that at some point I'll need another injection, but so far so good. I seem to be holding steady. That little spot cleared right up after the injection. And there are several medications now that are on the market. Wet AMD has been treatable since about 2005 with what they call anti-VEG injections. And this is kind of like the same, I think they use this for cancer drugs. What it does is it slows down the growth ability of some of these cells in your blood vessels. I think that's how that works. Anyway, they inject you right into the eyeball, and I had an injection with a medication called Avastin, and there are several others on the market now that are deemed actually even better than that, but I cleared with the Avastin. So they put it right into your eyeball, and it sounds barbaric and awful, but it really wasn't a big deal at all. Just was not a big deal. They numb your eyeball. Really, for me, the biggest concern about having that injection into my eyeball was that I wouldn't get that injection in my eyeball, because I knew that's what I had to have to save my vision. With wet AMD, it is unlike the dry form in that the wet AMD will progress very, very rapidly to vision loss, and it can be irreversible if you don't get it treated promptly. So that one's a biggie. You got to get right on it. You got to get right on it. Now let me back out of this one for a minute, because we know that the wet AMD is serious. We know that it is unusual, but we know that it is treatable. With the dry form, it is more common, but it does not always progress to cause vision loss. It is slow, and oftentimes it just can be slowed down, or the progression greatly reduced by taking what's called AREDS 2, which is a formula of vitamins and minerals that have been tested. There was an AREDS formula, original AREDS, and they had a vitamin A component in that, and they had to redo it because the vitamin A they were finding was causing some lung cancer in former smokers. There's a correlation between vitamin A and former smokers and cancer. So redid the formula, and lo and behold, they found that the AREDS 2 without the vitamin A was just as effective. Now, this vitamin combination also contains zinc, and sometimes zinc isn't really that tolerated by folks. I don't really care for too much zinc, so I found a good formula that has a lower amount of zinc in it. They're not hard to find, as long as it says AREDS. And then the other thing that they have found that is really helpful to slow the progression of the dry form is what they call the Mediterranean diet. The leafy greens, fresh vegetables, low saturated fat, avoid sugar, processed foods, stay away from it. And that seems to be really correlated with reduced progression in a lot of people. So you can have AMD and have it never go anywhere. You can have AMD and retain your vision for your life. It is not for certain, with any certainty, that you are going to lose your vision. It doesn't work that way. There are just such a varying degree of how this impacts people. Some people progress pretty rapidly, even with the dry, over a few years, and some people just go on to live to be 100 and never have it impact their ability to see. So doing the things we know how to do are the AREDS, and having a good Mediterranean-based diet, gentle exercise, get your blood pumping. I don't mean strolling, But, you know, you don't have to kill yourself being a power lifter if that's not what you want to do. But just getting your blood pumping regularly, good sleep. A biggie is wearing eye protection when you're out in the sunlight. I was really a miserable failure at that. I just don't like wearing sunglasses, and I would rarely wear my regular glasses outside, and now I do. I don't wear sunglasses, but I wear the UV protected eyeglasses outside. I've never smoked, but if you are a smoker and you've been diagnosed with AMD, that is probably, according to the research I've read, one of the biggest drivers. And so it's really a good idea to try to cut back on that or quit if you can. I must say that I was pretty much like the poster child for avoiding AMD. I've always eaten really well, plant-based diet, more leafy greens than most people I can ever imagine would eat. I sleep well, I exercise daily, and like I said, the biggest drawback with me was not wearing eyewear. I do think, and this is my own opinion, I do think that high stress can cause blood pressure spikes even if you don't have high blood pressure. And I do believe that stress with me, even though I'm predisposed genetically, I think that it really drove that bleed with me. I really do. Because I've had a lot of stressors in my life over the last several years, and the anxiety levels where it feels like your adrenaline shoots up. Well, along with that is your blood pressure shooting up. And so I kind of have a suspicion that in many cases, folks are responding physiologically to some of these changes that come from stress. Now, that's my opinion. I think I'm right. We'll see what science bears out over time with that. I think that probably the hardest part of any of this for me was the assumption that I was going to go blind. And that was, of course, very, very scary. And then when I came home and I started doing my deep dives in the research, there is so much out there that it's almost like fear-mongering. And of course, when you're new to something, to a diagnosis, and you don't quite know how to find the good, reliable resources that are true and evidence-based, you're going to run around a lot of stuff that is not good quality information, and it's going to scare you. So what I would like to suggest is do your research, but check where you're researching. Go to sites that are reliable and reputable. There's one I think is called Eyebright Foundation, and I believe, sorry if I'm wrong, I believe that one may be out of the UK, but it's online, and they have a lot of really good clips and interviews with doctors who are doing research on AMD. Another good resource that I found after sifting through a lot of them was a Facebook group called Our Macular Degeneration Journey. This group is top-notch. They are evidence-based. They don't allow a lot of these goofy snake oil cures to be suggested on there. They vet them, but they also have the latest treatment updates. And so you are able to find a plethora of information there and ask questions. It's a really active group. Again, I would like to caution you that not everybody's journey will be your journey. Most people who are on these sites are either really early in the journey and just scared, like I was, or they're folks who really do have maybe a more advanced form of this particular disorder. And so a couple facts. Dry AMD progressing to the advanced form of dry AMD and impacting your vision. The data, as I recall, is about 15% of people will get to the point that their dry actually develops into vision loss. And of the people with dry AMD, of any kind of dry AMD, only 10 to 15% of those go on to develop the wet. So don't hang up the towel and think that you're going to lose your sight right off the start. That one's important to know. Secondarily, the wet, as I said, does have treatments. The dry form is slow and may not progress at all. There are things that you can do to hedge your bets to keep it from progressing, and that's the AREDs and the not smoking and the more of the Mediterranean type diet. And as I pointed out, my belief that lowering stress where you can, always better for your health. And then with the dry form, even though right now there are limitations on what is available for treatment for that, that is where there is going to be a bloom of new treatments that are going to become available over the next several years. And I'll tell you why. There are several different kinds of injectables that they're coming up with. There are a couple new eye injections that are on the market now that are showing some promise of slowing it down, not reversing the progression of the dry. This is a dry. These injections are not the same as the ones for the wet. Those are two different categories. There are some light therapies that are now being used to slow the progression. And then there's also some laser therapies that are being used to slow the progression. The laser therapies, I think that one is still only used in Canada, and that was under the brand of Macumira. The red light therapy has been approved here in the US, and that's under what's called the Valida brand. But there are some other kinds of injectables, not eye injectables, but injections that they're going to be using to treat the dry AMD and prevent it. Several different mechanisms of prevention, and I'll go into details of how those work in another video. There are some medications, some oral medications they're looking at. There are some retina cell stem cells that they're talking about using in practice in clinical trials right now, where they're showing not just stopping of the progression of the dry AMD, but actually reversing, where some folks are getting back more vision. And see, that's a game changer. So there's going to be more and more of those in the pipeline, and more of those are going to be trialed and hopefully pass clearance to be able to be brought to market for patients in the not too distant future. So what I do know is that it is a frightening diagnosis, and early on you can immerse yourself and just really get scared to death and be really very, very frightened and filled with anxiety over this. But I think that taking a deep breath and slowing down and saying, okay, how many good people are really working on this problem? And I can tell you that there are a lot of research dollars going into this. It's a common problem. It is worldwide. After glaucoma, it is the number one. In fact, I think now it has moved to number one of adult onset blindness, I believe, because I think glaucoma now is considered to be, pretty treatable. And so I believe that AMD has moved into first place for that, for legal blindness in adults. So, but it doesn't mean that you're going to become legally blind. It's a very small subset of people that do. And of those, most of them can be treated. And of those who are progressing with the dry form, which does not have the best treatments yet, those treatments are coming. So be encouraged. Try hard not to be afraid. Follow up by having the best, healthiest lifestyle you can. Get a hold of some AREDS2 vitamins. Take them. Follow that Mediterranean diet. Get good exercise. Reduce your stress. And get good sleep. I'm going to wrap it up for today, and I'll talk to you soon. Bye-bye.